Good morning. My name is Julius Span. This is my recording for my counseling substance use disorder script. Uh, the client that I am seeing is Haley. I'm her counselor, so uh, I will start now. Hi, Haley. I want to start by saying thank you for your honesty and willingness to share your concerns. It's completely understandable to feel uncertain and overwhelmed right now. You're facing a lot, and it's my role to support you with compassion and clarity. Let's walk through questions together. Haley responds, Why do I have to take drugs if I am trying to get off of drugs? And I said that's a very valid question. It comes up often in people recovery. While it may seem contradictory at first, taking buprenorphine as part of the medication-assisted treatment is not the same as continuing. It's not the same as continuing substance misuse. Buprenorphine is a partial opiate agonist. It attaches to the same receptors in your brain as oxycodone, but it does not. But it does so in a controlled, less intense way. This helps reduce cravings and withdrawal symptoms without causing a euphoric high. You could think of it similarly to how someone with diabetes might use insulin. It helps stabilize your condition so that you can work on deeper behavioral and emotional healing in therapy. How will my medications? How will my medications for my anxiety issues work? Once your substance use is stabilized with buprenorphine, your psychiatrist will reassess your anxiety to determine the most appropriate treatment. Other selective serotonin reuptake inhibitors or serotonin non-referrin reuptake inhibitors are SNRIs are prescribed to treat generalized anxiety disorder. These medications work by adjusting the levels of neurotransmitters in your brain, help regulate your mood and anxiety over time. They do not provide instant relief, but gradually help reduce the intensity and frequency of anxiety symptoms, especially when combined with therapy. Are there any concerns with taking buprenorphine and medication for anxiety? Yes, and it's good that you're asking. Some anti-anxiety medications like benzodiazepines can be dangerous when taken with buprenorphine because both depress the central nervous system. This can increase the risk of sedation, respiratory depression, or even overdose. Fortunately, there are safer alternatives such as SSRIs or non-benzodiazepine anxiety medications, which your psychiatrist will likely consider. Close coordination between your provider will ensure you are safely monitored throughout your treatment. So, in conclusion, Haley, your questions are incredibly important. I hope my answers have brought you some clarity. You are not alone in the process. Recovery is a journey, and we'll walk through it together, one step at a time. I'm here to support your mental health, your sobriety, and overall well-being. If you have any further questions, just let me know. You can reach out to me or my office, and we'll make sure that we have scheduled time so that we can talk more about your the medications that we're gonna try to prescribe or get prescribed to you. Thank you.